So at any rate, something else we need to go over, and what we're going to go over today is sterile fields. Okay, opening up a sterile field. I don't really want that on. Do y'all want that on? Let's do that. So what I'm going to do is I'm going to talk to y'all. Y'all kind of scoot up this way. Kind of show y'all how to open up a sterile field. To at least use the sterile technique. So we're going to pretend like we've got a sink in here, and you all scrub your hands and all that good stuff. Okay. So what you would do, let's say CV. Who's been to CV? Okay. So you've seen the cut down tray and all that. You know what I'm talking about cut down tray. Okay, that's that Mayo stand that's got all the instruments on that they roll up to the patient to start the neck line, the central line, and the arterial line. That's a cut down tray. The anesthesia technicians set that up. And in the main OR, the same thing, like in a spine, cranies, whenever they're going to do arterial line. Okay, our central line, they're going to use a pack. We have two different packs that we are responsible for. We have a pack that's it's a central line, our CVL/arterial line down here in the main OR. We also have a CVOR arterial line that they use up in CV. They both have some similarities, but also they have there's a lot of differences between the two. What I have with me today is the one that they use in the main OR. So basically, we come in, we're going to get a Mayo stand. We're going to pretend that this is our Mayo. There's Janiqua. But we're going to go over opening up sterile fields, sterile techniques, and whatnot. Okay, so we're going to pretend like my black table here is a Mayo stand. It's an oversized Mayo stand, but at any rate, it's a Mayo stand. So what you would do when you came into the OR, you're going to have two different covers. You're going to have usually all your instruments and your packs and things are going to have an outer cover, a plastic cover that you're going to open up. So we're going to open that up and we're going to pull our pack out. Okay. So all this is going to be trash, and I'm going to save this over here because we're going to have some stuff in here that we need to dispose of. So next thing I'm going to do now, this outer part is not considered sterile. It's considered very clean. So before I open up any further, I want to go over here. We're going to, like I say, we're going to pretend like we have a sink. So I'm at least going to put some gel on and clean my hands. I want to kind of get them. This is just to open it up, okay? This is not to touch to get inside. So we're going to open this up. The way you do this, you got this little tab right here. You're going to pull this tab forward, okay? Let it hang like this. We're going to be in a big area. We're going to come over here. We're going to grab this side, pull it over here, and we're going to go over here. And I'm going to grab this side, and I'm going to bring it over here. Once again, Mayo stands are much smaller, so this is going to cover the whole Mayo stand. Then come over here. Now, if you'll notice, everything underneath this or down below this Mayo stand is contaminated automatically. And so you see how it's turned in an awkward position? We're going to spin it. We're going to kind of have it sitting squarely on the Mayo stand. Okay? So we want the drape to hang off the Mayo stand on all four sides. And usually it'll hang about this much on all four sides. Okay, so next, now this is all sterile. Doing this right here is a no-no. Okay, you don't want to do that. You want to consider this sterile. You want to have your mask up when you're opening this. Your mask should always be up. Anything that you have that can potentially fall over and contaminate, you want to make sure whether you lean over, you don't want any of that to contaminate. You don't want anything falling out of your pockets. So make sure you get rid of all those items before you do anything. You're going to have your mask on. We'll leave it off. Then usually you're going to have some extra items that you're going to, and I didn't bring me any gloves. Hang on. I'm going to cheat. At any rate, we're going to have this up here. One of the things we're going to want to do, I'll go ahead and open. I may be able to fit in these 7s. We're going to open up a pair of sterile gloves. Okay. What you do, there's a certain way you want to do this. If you'll look on the back, you're going to notice how it's kind of tapered down. Oh, okay, this end is not, it's directly across. And you also, you've got it where it peels apart. See what I'm talking about? And this is where you want to grasp it. Okay, can you see that, Janiqua?
Yes.
Okay, so what you're going to do is you're going to pull apart, and just like this, just like that. Okay, flip it over. You don't want to slide it off like that. You want to make a great flip. And I'm gonna open up. I'll open up one of these as well. I didn't bring a lot of things to open up. We don't want to waste a lot. However, all this stuff here is expired. Okay, so we got a needle. So a good way to open it up, just like that. Okay, if you open up like this and you pop it out, and you'll see a lot of people do that. They'll just they'll take it and go like this. Get one here. They just like that. Okay, it's okay to do that. However, I don't think Mosby's, their technique is they want you to peel it up like this, let it free fall out. There's always that potential that it could touch something here on the side that would contaminate. Again, this is sterile. We're treating this as a sterile field. Okay, so next what you would do after you've done this, we've washed our hands. However, now we're going to go scrub our hands and get them sterile. So let's pretend I've scrubbed my hands, done that. Okay, first thing I'm going to come back and do is, now I'm setting this field up. I'm not the clinician that's putting this central line in. I'm just setting the field up. So I'm going to come in here and I'm going to grab this towel. If you'll notice, these towels are set just like this, okay? You want to grab this right here, shake it, okay? And I'm going to dry my hands. I'm going to just work it on my fingers, work down to the end, okay? Then I want to come over with this hand, and I want to do the same thing with this side and go down. You don't want to go down here and then go back up, because you want to start, way you scrub your hands, you scrub from the fingertips back, okay? Fingertips back. And the way you dry your hands from the fingertips back, because this down here is contaminated. This is a disposable towel, you throw it away. And usually, like up in CV, the techs will have they've got they'll have a trash can there beside them that they can use to toss the trash in. Most of the towels, actually everything in here is disposable at any rate. Once you've got your hands dried, you can reach over, don't touch this, just touch this. Grab your gloves. Usually what I'll do is I'll take it and I'll come over here, just like this. Flip it open. Now your hands are not, they're clean, but technically they're not sterile. Okay. So what I'm going to do is I'm going to pick this glove up right here. This may be difficult with me for such a small glove. Just like this. Whenever I pull up, I'm going to grab right here, and I'm going to pull it all the way up. Okay. So the only thing that's really sterile is from here down. Then I'm going to come over and I'm going to grab this glove right here, kind of slip my fingers under. And I'm just going to, I'm going to don it over my hands just like this, okay? Fix your fingers. I did get them on. Fix your fingers just like this. It takes practice to do this. It takes a lot of time to do this. So now I'm considered sterile. Now I can go in here and I can touch all this stuff and I can set my field up. So what we're going to do, this particular pack in the main OR has a gown, whereas in the CVOR, there's no gown. There's a bunch of towels and some other things. And if you'll notice here, we have a bunch of items in here that are still in packs. They're sterile, but we're going to open them up and set them up. So here's what we're going to do. We're going to get everything out, kind of set this thing up and have it nice and neat. Okay. Take this. This is a drape that's going to go over the patient. So what I want to do is I want to have sit all back here. I want to have everything looking nice and neat here. Okay, we're going to use our towels. Those are towels for draping the patient. What they'll do is they'll take these towels and they'll kind of corner them like this. And if you'll notice that little triangle there, they'll lay that over the incision, and then they'll bring another one. And the clinicians will do this, and they'll do it kind of like this. Okay, so they got their work area right here. Then they'll take this drape and it has a hole in it, and they'll place it right on top of that and then spread it out over the patient. Does that make sense?
Start all this.
We're going to set this field up. We're going to set it up. The clinician's going to come in and do all this.
Oh.
Once the clinician comes in and does that, you usually don't have to be scrubbed in or anything to assist them. They can do all that on their own. But I'm just showing you what the clinician's going to be doing. So at any rate, that's usually how they drape their patients. Some of them do it a little bit differently, but the majority of them do it just like I showed you. Okay, so we're going to have that laid out to where they can grab it. One of the things, and mine's not very neat now because I've messed it up. You want this all kind of nice and neat. And the way I do it, if that's the back of the Mayo stand, this is the front of the Mayo stand. Okay, so here's my patient right here. So I want to have this to where I can pull like this. If you have it turned like this and you grab, a lot of times the towels may fall apart, you may drag it onto something. So if you have it to where, you know, you're not responsible for making sure that they don't touch anything, or they're responsible for ensuring that that towel stays sterile to the patient. So, you know, if they grab it like this, they have to unfold it. If it's turned like this, it may unfold as they're dragging it across and touch something. And, you know, they're not going to be paying attention to whether or not it touched anything. But they're going to gown up. So this is going to already be on them. So we're going to get that out of our field. Next thing that we're going to do, these are, like I say, all this is expired. These are all sterile. So I'm going to open up 2 of them, and I'm going to set them out here on my field. These are chloropreps, or chlorhexidine swabs. Okay? And we're going to use these to prep the patient's skin. So we want to have, and we would actually open up all 4 of them, but to allow y'all to open up stuff too, I'm going to pull this off. I want to get rid of all the trash. See these little label things here? That's trash. This here stuff that we want to open up. We'll leave that up here. I'll do this. We'll save some. We'll open one up. So I'm going to open this up. This here's trash. Okay, this is called a bile patch. This little patch, we have 2 of them. We have a small one and a large one. This is what we're going to put after you have your catheter in, wherever it may be. We're going to wrap this around that catheter, and this helps prevent infections. Very, very good piece of equipment to prevent infections. So we're going to get rid of all of this here. And once again, like I say, you'll have a trash can sitting there beside you to throw it away. I didn't see any suture, huh? Okay. So these 4x4s, I like to throw them back here. This little specimen cup, we're going to put heparin in it. Okay. We want heparin. We want everything labeled that is going to have heparin in it. So we're going to label this, or whatever drug it may be. It doesn't matter what drug it is. You got to have a label on it stating what it is. It's a JCO requirement. So all of these syringes that we're going to be using in this pack, we want to be sure that we have labels that are labeled with heparin. And you will have heparin. You will draw that heparin up into these syringes out of this cup, and you'll set it up. I'll show you how to do that in just a minute. I wish we had some water. Squirt me some. Well, you can just squirt some in here. Do it sterilely. You touch the cup.
Fired.
That's good. Okay, so we're going to pretend like this is heparin, okay? All right, so I'm going to take these prep sticks. These are going to be some sticks that we're going to use to prep the patient. Once again, remember, you're very limited on space up here. We got a supersized Mayo stand, but y'all seen the Mayo stands in the rooms and how small they are. Okay, this thing here, this is a sharp box. Okay, so we're going to have all of these sharps that we use. We can stick them in here. We got a magnet and we got a foam that we can just poke them in, just like this right here. They use it, and that's why we keep it, and then we can discard it, throw it in the trash later, or in the sharps container later. So that's right up here. I'm going to put that right in there. We'll pull this out. We set these up. This here is a safety needle device. I hate these things, but at any rate, I break them off. I twist them off and break them off. The faculty don't like them, but for JACO we have to have it. All right, so I'm gonna set these up. This is an IV catheter, standard IV catheter. You're gonna have about 3 or 4 of them up here. I have those set up. I don't know where our suture is. This here is the knife blade, and I have absolutely no. There we go. Okay, so and it's got a safety feature on it as well to keep it covered. Anyway, I'm gonna set this out here. Dang, I can't believe. At any rate, we would take our suture. Is there a suture in there? No, no. We would take our suture. Let's just pretend this is the suture. Okay, you got your curved needle up here at the end. I would grab hold of that curved needle. I don't have anything to wipe on. I would have that curved needle, and I would grab hold of it there at the needle, where just as it's in its curve, just like this. So the needle's curved like this. Let's just do one. Let's quit screwing around. Just do one. I'm gonna sit here and run this needle through my finger. Okay. A little bit. They don't hurt for very long. Okay, so we're going. You kind of get the general idea that it's curved. Okay, so the reason for it being curved is so that you can kind of go like that. Okay, do y'all see that? Mm-hmm. Okay, I see techs coming in all the time to set this thing up just like this. Okay, how are you going to drive that through the wrist with it loaded like that? You can't. The only way you can do it is just like this. Just like this, okay? Just like that, okay? That's the way you want it to do. You want to get about in the middle, and because I can't make a true curve with this, but you want to have it about in the middle and use it just like that. So what I do, I load it up, I pull just enough of it out of its little pack, and I set it just like this. The needle's down, it's sitting on top of the pack. It can't be disturbed where it punctures something. Because see, what happens if we puncture through this paper? We've contaminated our whole field. So it comes in its own package. So and it's a kind of it's not a cardboard, but it's about the consistency of maybe 2 of these. So it's going to be real hard to puncture through it. You know, you have to really try to get punctured through. So I just let it sit on top there, just like that. Okay, these are these things here. We're going to do an A line and a central line. Usually our central lines are going to be a 2 lumen or 3 lumen. I brought some central lines just so y'all can see, and we'll play with as well. Usually you'll have, if you're setting this up and you know for a fact this is the size line they want to use, this one here is a 7 French 20 centimeter line, triple lumen. Does everybody know what I'm referring to whenever I say a triple lumen? Yeah, this is a triple lumen, okay? And it's one. This is what goes into the skin, and you suture it down right there. So all of this is down inside the vessel, okay? So this is like I say, this is a 7 French triple lumen line. I'll pass it around and let y'all look at it. But we're going to open up all this on the field, and we're going to have it all set up for them. So once again, we want to come up here, have this readily available. If they don't know what size they're going to be using, then we won't do this. You know, you'll just open it up for them after the procedure is started. But if they do know, we're going to go ahead and have this set up and ready to go. So what we're going to do, we're going to do an arterial line and a central venous line. We've got a 7 French triple lumen catheter that we're going to put in. We're going to draw up our fluid, okay? Because we don't like what? What is the one thing we don't like in our IVs? And air. So what you're going to do is you're going to take it, give it a thump, okay, and you're going to squirt a little bit out, okay. Why did I do it just like this? Why not do it like this?
Because the air goes up.
Air goes up. So if I take it and I'm sitting here and I give a thump and then let me back up. You also, once you get all the air out, then you can come back and I run it down to about between 1.5 and 2 mLs in the syringe. Not everybody does that, but I do. 2 reasons for doing that. That gives me 1.5 to 2 mLs of heparin in my syringe. Okay. If I, whenever they get that central line, and that's for nasal line, whenever they get that central line, and you have it backed up all the way back up to here, okay. If they try to aspirate and this whole thing's full of heparin, and you can't pull it back any further, you can't aspirate. They want to aspirate on that central line. So I flush it out about 1.5 to 2 mLs, and I'll show you. And here's what they're going to do. Whenever they hook up to this thing, they're going to want to aspirate, and they're going to want to suck back until they get blood in the syringe. Then they're going to want to flush it through the syringe, or flush it through the central line. Does that make sense? Mm-hmm. Okay. But if this thing's full, and also if it's near empty, if you're down less than 1 ml of heparin in here, there's not enough to flush the thing. And then, but if you have too much in there, you can only aspirate or draw back so far. 1.5 to 2 is a good safe number. And that's what I'll do, like I say, I'll just come in here, draw them up, flush them down, lay it down there just like that. Same, I do it with all of them, just like that. And just leave all 3 or 4 of them, however many you're going to have, sitting up there ready for them. They'll hook them up and flush them. Now on this particular one, you notice we have a lure lock. This is a lure lock syringe. You notice the difference between the 2 syringes, correct? Okay, we use this lure lock for the A line. Now once again, I flush all the air out. And okay, on this one, I don't flush anything out for one reason. I got to flush this whole line here. So what I do, I come over here to this stopcock. This is a 3-gang stopcock, actually a 4-way stopcock. I take it, okay, if you'll notice, off, where it says off, okay, I can only flush to this line right here. This is a airtight cap that's on here. Some of them are airtight, some of them are not. This particular cap right here is not airtight, so if I put it on, I can flush. See, I'm flushing with it even being tight. With this particular cap, when it's on, I can't flush. It's airtight, it won't allow anything. So, but you have to loosen it up a little bit. I flush to this port just till I get a drip, then I turn it and I flush up to here. Once I get flushed up to there, I hook up to this. If you'll notice, and then I flush it all the way up to the top right here. Then I'll go back and I'll turn it halfway. That prevents it from backing up any. So whenever they go to hook up to the arterial line, all they have to do is aspirate. They don't have to worry about a bubble being in there. They immediately aspirate a little bit, see that there's no air, and then they flush it off. You'll notice I pulled all those caps off of it. Okay, here's the deal. Put your hand up here, Megan. Turn it over. Okay, I'm sitting here. I got the catheter. Do the other one. Let's make it easier for me. Okay, we got the catheter into her artery. Okay, so I'm holding pressure right here. Okay, now I'm going to take this and I'm going to hook up to that catheter, because if I let go, if the catheter's in there, an IV, it'll just drip. If it's an artery, what's it going to do? It's going to squirt, and we're just going to pump blood all over the floor and everywhere else. So by holding pressure here, by having those caps taken off of here, how can I take it off? You know, I'm sitting here twiddling with it right here. Okay, make it easier for them. You know, hold it right here. I go down. Once I get this inside the catheter, I twist it on. So once again, you know, you're holding pressure on this thing. So you know, just like I say, put your hand up here. We're going to put a catheter in you after all. So I'm holding it like this, so I can reach over here. Now I can let loose and I can snug it down. You know, you just don't want to make a big bloody mess. So that's the reason why we go ahead and pull all those caps off and have it ready. And then they'll come back, they'll aspirate, suck back till they get blood and there's no air. Then they'll flush it, and then they'll turn it off just like this and bring it back and let you tape it later. And that's usually what these tegaderms, or they'll throw a tegaderm on it, either or. Okay, so you kind of see what we're doing here. We got everything laid out to where it's just very convenient for them to come up here and grab these things. You know, back to our central line, you know, we just have it sitting up here and ready for them. They know where everything is, that they can see it in plain sight. They got their, this is their stylet. Basically what they're going to do is they'll use this needle right here. Yeah, it's not, actually it's not a big one. They'll use this needle right here, huh?
It's not big.
No, actually it's not compared to some of them. But they'll use this to make their puncture. Usually it's going to be in the neck or something, and they'll go for that neck vein. And they're going to be drawing back just a little bit on this syringe. They're going to be aspirating a little bit. And how they know that they're in the vessel is they'll get blood back. You know, blood will squirt back up in here. Then they'll stop once they get flow of blood coming through, and they may pull up this much. Then they'll stop. They'll remove this. A little bit of blood's dripping. They'll come back and they're going, this is their guide wire, and it's called a J guide wire. They're going to come back and then they're going to thread this wire all the way through. They're going to be looking at the monitor, and what are they looking for? They're looking for some, basically I call it a tickle of the heart. You know, the EKG will kind of tickle, run around and tickle, because what's going to happen, if we're in the right place, this is going to go to the heart. And just before it hits the heart, there's going to be a fluctuation in the EKG, and you'll see it, and they're going to stop. And then what they're going to do, they're going to stop, they're going to pull this off, and then they may make sure that they got a tickle by running it up and down a little bit and tickle the heart a little bit. And then they're going to pull this out. This is called a dilator, okay? And this is sitting inside your neck, and you got a little bit sticking out. Then they're going to thread this dilator over. They're going to be holding pressure. They're going to thread, and then they're going to just run it in and out of the neck. They may even take the scalpel, and they may make a little nick in the neck there so that this can flow freely. And if you look, that's pretty good size. We got needles that are that big too. But at any rate, flow that through there. And basically it's a dilator. It's going to dilate the skin, and it's also going to dilate the vessel, so that whenever we come back and we take this that's running and we run it over that wire. Get my trifocals going here. We thread. Now this, the way they do this, they thread down, they pull this back, and they want to catch it. Well, we got to take off the caps here. I'm sorry. We want to catch it as it comes out. It's going to come out the distal end, the brown end here. So now we take it, we thread this all the way in, and then once it's in, then we pull it out, and that's when we hook up these 3 syringes here. Go to each one, they aspirate, get blood back, they flush it off, go to the next one and do the same thing. Then they're going to suture it up right here, right up to the skin where these 2 holes are here. They'll use those as sutures. Okay? And that's pretty much it. Any questions, concerns? These prep sticks, the way these prep sticks work, there's a amount of fluid inside them, a chlorhexidine. You turn it down, squeeze it, you just kind of give it a little jump, and you'll see that it's got the skin. You start from the middle and work out. You don't, that's not the way you do it, middle and work out. What's the purpose in that? Because the germs that you collect here in the middle, you start working your way out, you're carrying them away from the injection, the puncture site. If you do this and go all the way across, you're dragging the germs that are over here across the puncture site, and then you're dragging them back and all that. So they always tell you to work in a circular motion. If you've had anybody that's had an epidural or something like that, they do the same thing. They kind of go in a circular motion, work their way up. Okay, any questions?